Hi there, my name is Samantha, and I'm a nurse at the Mother-Baby Unit at the Ottawa Hospital. In this video, I'm going to share some basic information about what to expect once you're discharged from the hospital after giving birth. Over the next few minutes, we'll talk about medications after giving birth, activities and physical recovery, what you can eat and drink, bowel movements, and booking your postpartum follow-up. Before we begin, please note that the information in this video is not medical advice. Some of it may not apply to you. If you have any questions, please talk to your doctor, nurse, or other healthcare team member. For urgent matters, please call 911 or visit your nearest emergency department. Now let's begin with information about your medication after birth. At discharge, you may be prescribed pain medication and/or medication specific for your after-birth recovery. Be sure to take your medication as ordered by your healthcare provider or midwife. Most people need to take pain medication regularly for a few weeks after giving birth. For most people, it is safe to take both ibuprofen, also known as Advil, and acetaminophen, also known as Tylenol, together. Your healthcare provider will let you know if you can take both ibuprofen and acetaminophen together once you get home. You should take your pain medication when you need it. If your pain does not improve and/or gets worse a few days after giving birth, contact your healthcare provider. You also want to watch for signs of an allergic reaction when taking your pain medication or other medications that are prescribed for you. Keep an eye out for a rash, hives, or swelling in the face or mouth. For mild reactions like rashes, hives, or swelling, contact your healthcare provider. If you have any difficulty swallowing or breathing, go to your nearest emergency department or call 911. Now, let's talk about activity and physical exertion. For the next 6 weeks, as you recover from giving birth, you will want to take special care about your activity. Increase your activity slowly. Remember to take breaks and rest as needed. For the first 6 weeks after giving birth, you should not lift or carry anything heavier than 10 to 15 pounds. Try to avoid anything heavier than your new baby, a medium-sized laundry basket, or 2 small bags of groceries. You should also avoid any strenuous exercises or activities such as running or lifting heavy weights. Rest and recovery are important for you and your baby. Consider talking to your healthcare provider to see when you can return to the gym. Do not drive a car or use heavy machinery like tractors or cranes if you're taking prescription pain medications, for example, Dilaudid, or you're still feeling pain after having a cesarean section. If the pain stops you from quickly pressing the brakes or moving without discomfort, wait until you feel better and you can do sudden movements without hesitation. You can test this in your driveway. Follow your doctor's instructions about when you can start driving again. Let's now talk about what to eat and drink after giving birth. Once you have been discharged, you can restart eating and drinking what you normally eat and drink, unless your healthcare provider has told you not to. It's a good idea to eat more iron-rich foods to help recover more quickly. Some examples of iron-rich foods include meat, fish, seafood, eggs, lentils, granola, or dried fruits. It is also a good idea to eat more foods rich in fiber, such as seeds, bran, oats, vegetables, and fruits. This brings us to bowel movements. Eating a variety of foods high in fiber and drinking lots of fluids will help promote regular bowel movements. You should have a bowel movement by day 5 after giving birth. You can also take polyethylene glycol 3350, also known as stool softener, such as Pegalax or Laxaday, daily until your bowel movements become regular, which is 1 soft bowel movement a day. Avoid straining or pushing hard during your bowel movements. If you are prescribed pain medications, such as Dilaudid, take a stool softener every day while you're taking your prescribed pain medication. This will help keep your bowel movements soft and regular because some prescription pain medication can cause constipation. If you have a vaginal tear, taking a stool softener will help keep your bowel movements soft, and this will help with the recovery of your vaginal tear. If you do not have a bowel movement by day 5 after giving birth, please reach out to your healthcare provider. Lastly, to conclude this video, just some quick words about your afterbirth or postpartum follow-up. You'll need to make an appointment with your family doctor or nurse practitioner for 6 weeks after giving birth. If you do not have a family doctor or nurse practitioner, you can reach out to the healthcare provider, obstetrician, or midwife who followed you during your pregnancy and make the 6-week follow-up appointment with them. if you sign the Authorization for Release of Maternal Child Information to the City of Ottawa Healthy Babies, Healthy Children Program form, a nurse from the Public Health Unit will contact you by telephone within a few days of going home. If you live in Quebec, your signed authorization will be sent to the closest CLSC. You'll be contacted by the CLSC nurse to plan your follow-up appointment. Please remember that after you are discharged, if you have any urgent problems, contact your doctor, midwife, family doctor, or go to the nearest emergency department. For non-urgent concerns, you may contact the Health 811 by calling 811 or 1-866-797-0007 at any time. And that concludes our after-birth discharge information video. Please let your nurse know if you have any questions or concerns regarding the information in this video before you leave the hospital. Or, if you have already been discharged, reach out to your healthcare provider with your questions. For more information about caring for yourself and your baby once you have been discharged from the hospital, the links to more helpful videos are in the video description below.